Imagine a powerful duo that fights against bacterial infections, a combination of two medicines, amoxicillin and clavulanic acid. This dynamic pair has a unique synergy, where amoxicillin, a penicillin-like antibiotic, kills bacteria by disrupting their cell walls. However, some bacteria can resist by producing an enzyme called beta-lactamase. That's where clavulanic acid comes into play. It's a beta-lactamase inhibitor, meaning it blocks this resistance-giving enzyme, allowing amoxicillin to do its job effectively. The wide range of bacterial infections that this combination can treat is truly impressive. From ear, nose, and throat infections to urinary tract infections, skin infections, and even more serious conditions like pneumonia and bronchitis. Quite the powerful team, right? So now you know the importance of this dynamic duo. But how does it work? Let's find out. You might wonder, what is the mechanism behind this powerful combination? How does it battle against the harmful bacteria? Let's start with amoxicillin. This is a type of antibiotic known as a penicillin, and its primary role is to kill bacteria. But how exactly does it do that? Well, imagine the bacteria as a fortress. This fortress is protected by a strong wall, the cell wall. Amoxicillin works by preventing bacteria from constructing this protective wall. Without it, bacteria become vulnerable and eventually burst open due to the pressure difference between their inside and the outside environment. This, in turn, leads to the death of the bacteria. Now on to clavulanic acid. This isn't an antibiotic. Instead, it's a beta-lactamase inhibitor. Beta-lactamase is an enzyme produced by some bacteria that can break down antibiotics like amoxicillin, making them ineffective. This is one of the ways bacteria can become resistant to antibiotics. Clavulanic acid steps in to prevent this. It blocks the action of beta-lactamase, ensuring that amoxicillin can carry on with its bacteria-busting job without interference. So when you have amoxicillin and clavulanic acid combined, you have a pretty powerful team. Amoxicillin is working hard to destroy the bacteria, while clavulanic acid is making sure nothing stops it from doing its job. It's like having a star football player scoring goals, with a robust defense making sure the opposing team can't get the ball. This dynamic duo is often used to treat a variety of bacterial infections, from respiratory tract infections to skin infections, and even some types of urinary tract infections. It's a versatile combination that packs a punch against many types of bacteria. So that's the secret behind their power. But what should you be cautious about while using this medication? Before you start using any medicine, it's crucial to know about its potential side effects and precautions. So let's delve into the world of amoxicillin and clavulanic acid. Like all medicines, this combination can cause side effects, although not everyone gets them. Common side effects can include upset stomach, nausea, and diarrhea. If these bother you or appear serious, let your doctor know. In rare cases, this medicine can cause a severe allergic reaction, symptoms of which may include a skin rash, itching, shortness of breath, swelling of the lips, face, tongue, or throat. If you experience any of these, seek immediate medical help. Now let's talk about precautions. If you have ever had an allergic reaction to any antibiotic, inform your doctor before starting this medication. Likewise, if you have any kidney or liver issues, or if you are pregnant or breastfeeding, it's essential to let your doctor know. One of the key precautions while on this medication is to complete the course, even if you start to feel better. Stopping the treatment prematurely can lead to the bacteria becoming resistant to the antibiotic, which makes future infections harder to treat. Moreover, this drug can affect the results of some medical tests, so always inform healthcare professionals that you are taking it. And remember, this medication is for you. Do not give it to others, even if their condition appears to be the same. Now, who should avoid this medication? Well, anyone allergic to either amoxicillin or clavulanic acid should stay clear. Also, if you've had liver problems or jaundice while using this combination before, it's a no-go. In conclusion, while amoxicillin and clavulanic acid can be highly effective in treating a wide range of infections, it's important to use this medicine responsibly. Always inform your doctor about your medical history and any medications you're currently taking. And remember, if you experience any side effects, seek medical help right away. Now that you are aware of the precautions and side effects, let's move on to the dosage. The effectiveness of any medication largely depends on its correct dosage. That holds true for amoxicillin and clavulanic acid too. This powerful duo is used to treat a variety of bacterial infections. But how much should you take? Let's dive in. Typically, the dosage depends on the type and severity of the infection. For instance, for a mild to moderate ear, nose, or throat infection, the recommended dosage for adults is usually one 500 mg tablet every 12 hours or one 250 mg tablet every 8 hours. For more severe infections or those caused by less susceptible bacteria, the dosage may be doubled. For skin and urinary tract infections, the dosage can vary, but it usually follows a similar pattern. The dosage for children, however, is determined by their body weight and the severity of the infection. It's crucial to consult with a healthcare professional to get the right dosage for you. Now, what if you miss a dose? Don't panic. If you remember within a few hours of the scheduled time, take the missed dose immediately. If it's already time for the next one, skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. And what about overdosage? If you suspect you've taken too much, get medical help immediately. Overdosage may lead to severe nausea, vomiting, rash, drowsiness, and hyperactivity. In conclusion, amoxicillin and clavulanic acid is a potent combination in the fight against bacterial infections. But like any medicine, it must be used correctly. Dosage matters. Always consult with your healthcare professional to ensure you're taking the right amount. And that's a wrap on our discussion about amoxicillin plus clavulanic acid. Subscribe and like this video if you found it helpful. Remember, knowledge is the best medicine.